Hi there, welcome to our video explaining reverse pressure softening and what it actually involves and does. So particularly around day 3, day 4, when your milk's starting to come in, you might find that your breasts are quite engorged, and this can cause some uncomfortable feelings for you. Your breasts can be quite tender and your baby can get quite frustrated because they're trying to latch onto your firm breast. So this technique works by using your hands, and you're using your fingers to move the fluid that's gathered in the front of the breast backwards back into the breast tissue, and this helps mould the shape of your breast and can help your nipple protrude, which can make it easier for your baby to latch. It relieves the pressure and it can actually help your baby transfer milk more effectively because they're able to get more breast tissue into their mouth. That reduces the risk of nipple trauma, and it can actually as well help trigger an initial letdown. So let's have a look at how we do it. Okay, so if we just do a demo here, any finger combination is fine, whatever you feel comfortable using. As long as you've got the flats of your fingers and you're pressing as firm as is comfortable, that's absolutely fine. So a lot of people find your first finger and your middle finger works as a good combination. Some people like to use their thumbs. Some people like to use the whole of the flats of their fingers, whatever you feel comfortable with. So you're going to apply firm but gentle, steady pressure at the sides of the nipple and hold that for about 30 seconds or so. After that, you're going to drag the fluid away from your nipple, continuing that steady pressure. Okay, and continue the process all around the nipple. So holding for 30 seconds and then pushing back. So if you imagine that fluid that's gathered around this area, that's making that area behind the nipple very firm, the fluid is gathering there, you're putting that 30 seconds of pressure on, and then you're pushing it back into the breast tissue. Continue around until this area around your nipple and the areola feels a bit softer. And then that should hopefully help your baby to latch a little bit easier. It's important that as soon as you've finished doing this, it's only temporary. It's only going to push the fluid back temporary. So try and latch your baby on as soon as you can after you've softened that area. Okay. So hopefully that demo has helped and given you some confidence to have a go with reverse pressure softening if you need to. Just to recap some useful tips. So don't hurt yourself, only apply the pressure as is comfortable. Try and latch your baby as soon as you can, hopefully within a minute of completing the reverse pressure softening. The more engorged you are, obviously the more time it may take to soften the areola and nipple area. If the reverse pressure softening doesn't soften your breasts enough, you can hand express some milk as well, and that can help. Perform reverse pressure softening before each feeding session until you no longer experience engorgement. Obviously, if it's ongoing and your engorgement is severe, seek some further advice.